Now, as countries around the world mark World Heart Day today, doctors in the UAE are reminding members of the public to get a checkup. Plus, with new research showing that COVID-19 patients who were previously hospitalised could be at increased risk of heart problems, we spoke with Dr. Nooshin Bazargani, the consultant cardiologist at Dubai Hospital and chair of cardiovascular disease prevention of Emirates Cardiac Society, to find out exactly who's at risk.
COVID-19 being infectious disease has actually proven to us what we always campaign about. We always say that cardiovascular disease is #1 cause of hospitalization and mortality, not only in UAE, globally as well. And here we are talking about a virus, and that virus actually kills patients through cardiovascular disease. So patients with COVID, unfortunately, initially in the pandemic, they were coming with heart attack, and a number of them, they were coming with heart failure because it has a direct effect on the myocardium, on the muscle of the heart. And also it has a clotting effect on the vessel and arteries of the heart. So commonly we were seeing patients who were COVID positive attending as an emergency with heart attack and heart failure.
So are you seeing more cases of heart failure or heart attacks these days? And what are some of the common warning signs to be aware of?
All the registries and the research studies that has been done in UAE has shown that #1 cause of heart failure is actually heart attack. So if a patient has problem with the blockage of the artery vessels of the heart and they have heart attack, that can impact on the heart muscle and makes the heart bigger and makes it a failing heart. So the #1 cause of heart failure is heart attack and problems with the vessels. But of course there are cases that they have heart failure because of the genetic factors. There are cases that they have heart failure because of the virus or because of the COVID. There are cases that they get a cardiomyopathy or heart failure during pregnancy. But these are a small percentage of overall heart failure population that we see.
And what are some of the treatment options? Is it about getting a stent put in your heart? Is it pharmaceutical? What typically do we see as the best outcome for most patients?
A stent usually we use for patients who have heart attack, and if we put the stent and appropriate treatment and lifestyle modification for a patient who has heart attack, the chance of him having and reaching to the final destination, which is heart failure, is less. But for the management of heart failure, it's usually the pharmaceutic therapies. And heart failure pharmaceutic therapy and management is one of the most promising therapies that we have ever seen in cardiology, because we have modalities, we have some pharmaceutic agents that can actually change the course of the disease, can actually save hearts, save lives, save muscles, saves quality of life.
Now, you've launched an important awareness campaign with the Emirates Cardiac Society. Tell me a little bit about it. What are you hoping to achieve?
Simply, we want people to know that when to seek medical advice. The earlier they come, the earlier we can diagnose them, the earlier we can treat them, the earlier the heart will get benefit of the appropriate treatment.
And what's your final message for people watching today? What's your biggest takeaway or piece of advice for them?
I would say that although heart failure is a chronic disease, although it may disturb the quality of life, but don't worry. If you come to us early, if we can diagnose you early, then there are a lot that we can do for the management of your heart failure, for the management of the quality of life, because quality of life is a very important aspect of heart failure management. So simply, I would say that please take care of your heart, because your heart cannot wait.